Today, I would like to thank Rhinogram for sponsoring today's webinar and welcome our presenter, Dr. Keith Dressler, who is the founder and CEO of Rhinogram in Chattanooga, Tennessee.
Thank you, Jean, for having me, and thank you everyone who's in attendance here. I have incredible respect for each and every one of you as healthcare providers. You are true heroes, and I'm hopeful that this webinar will help you even become better. So let's get right to it. And what are we going to learn today? Well, we're going to talk a little bit about the new normal with COVID. We're going to go over and examine real live examples of practices who have successfully employed telehealth and remote patient monitoring. And then we're going to go over what you should be looking for if you do not have a telehealth platform, what you should be looking for in a telehealth platform. So I want to share with you, because I know a lot of you guys are like me. I'm also a healthcare provider, and it's tough right now with patients. It's tough right now with staff, being able to, in teams, being able to communicate back and forth. And to us, it seems like a big change has occurred. But what I want to share with you is communication has changed a while back, and voice calls and the phone are no longer the preferred way to communicate. As a matter of fact, 84% of patients, when surveyed, want to text their provider's office. And why do they want to text the provider's office or social media message the provider's office, either or? And that is, it is way more convenient to do so. They can do it on their time, and actually, for the providers can respond on their time, especially if they know it's not something urgent. But providers need compliance. So patients want the convenience, providers need the compliance, and more than ever, convenience has become an expectation. So I really want you to begin to dream a moment with me, because you look at these companies here and they basically are companies that have, you take Uber, for example, and they have changed the way cab drivers or the cab industry works, and because they were able to bring more convenience to the equation. So when we think about healthcare, what can we do and what can we imagine? So the first thing we want to try to imagine is a new modern cloud-based communication platform that would allow your practice to engage with your patients the way your patients want to engage with you. So what would that mean? Well, that would mean being able to text with them. How cool would it be if a practice could have a HIPAA compliant textable number that patients could text back and forth with you? And how cool would it be if that number corresponded to the voice number and you wouldn't have to do anything? Patients simply have that number in their phone already, that they're voice calling you, and you could tell them you can text or call with us. And to me, that's pretty cool. There's no portal for the patient to log into. There's no app for the patient to download, and there are zero barriers for a patient to actually engage with your practice. The second thing that might be cool would be if they found you on the web and they're searching around, and wouldn't it be nice if they could just somehow message you from your website and you be able to handle all of those messages? And last but not least, if you have, let's say, a social media business page, for instance, a Facebook page, and it has Messenger on it, wouldn't it be neat if messenger could come right into a communication platform and you be able to communicate there so that you meet patients where they live. But I want you to imagine and dream even deeper than this. I want you to also imagine that messages coming in, let's say down at the bottom, can you text me my most recent bill? And it gets routed to the billing department. So basically, the front desk is going to route it there, and it'll be the billing department that'll be responding, and they can attach the invoice. And how about a text to pay button, so they could pay right there. So there's none of this sending out all this stuff and again bogging down a system. Or let's dream a little more. How about somebody sending in a picture of something like at the top, my swelling hasn't gone down, and they've taken a picture of it, and that would be sent to a care team who's licensed to look at that picture and understand if they could, what to recommend from there. Or do they need to set up a video conference with them that they could do right then and there? The two words that you hear all of the time are going to be asynchronous and synchronous telehealth. Asynchronous is them texting pictures and different things and communicating with you, different symptoms and whatnot. And then synchronous is true bidirectional video. So wouldn't it be cool to be able to have both of those within a modern communication platform? So last but not least, wouldn't it be cool to imagine messaging with each other about patients, office policies, lab results, and especially, let's say, like in the COVID situation, all the new law changes, all the changes you're going to have when you get back in your office that you're going to have to implement. And you could actually communicate from anywhere, because this is a cloud-based system, and all of this would be in one system for you to use. It's not like you're going to have a separate this or separate that. This modern communication is going to free up hours of time every day for everyone, making everyone happy, the staff, the doctors, not to mention creating a patient experience like no other. Well, let's talk about the new normal for a second. And the new normal is, how do we keep our practices running virtually now? And for those who cannot work, like myself, we have been mandated to stop work except for severe emergencies. What are we going to do? Well, we need to leverage some sort of telehealth and virtual care platform so that we can actually triage, speak to patients when they're at home, keep them at home the best you can, so that we can keep them safe, us safe, and our team safe. Also, you would be able to advertise on your website and social media that you're not really closed. You're closed for in-office visits, but you are actually open virtually. So anybody that has any questions can text, can send pictures, can be triaged, can be spoken to. Anxieties can be alleviated. All of this can happen if you can begin to see patients virtually. Those that need to come in are your true emergencies, and you would be able to determine that. Like I said, if you can't determine it through asynchronous forms, you would set up a video chat with that patient and be able to make a decision if they need to come in or they do not need to come in. And biggest thing in my opinion, that we've got ahead of us is whenever this passes, how are we going to handle all of the patients that are going to all want to come in on that first day we're back open? So here's what we're facing. We've got mandatory closures across all specialties. You've got high numbers of cancellations and no-shows. Even if you could work, lots of people are not going to come in because they're going to, again, want to do what the government's asking and stay at home. And then because of that, there's extreme patient call volume that's probably coming in, and you may not even be there to answer the call. Either you can answer it, or it's being answered by an answer machine, or maybe it's being forwarded. I don't know, but it's much more difficult to manage when you're not able to be in the practice, or when you have limited folks working in the practice each day. And it's, again, extremely difficult to engage with these people on current treatment plans. And especially if it's more than you, if it's other specialists that are involved, it is incredibly difficult to understand what the patient needs during these times. And as mentioned earlier, communicating with your staff members remotely is a lot different than if we were all there and huddled together and being able to speak about what we were going to do and what we're going to change, and to have meetings. So having meetings remotely is a little more difficult. And then obviously I mentioned this as well, we have, at least I have, limited access to my office email, my office phone, my office files. Any of that is very limited today. So I've got some good news. The platform, that modern platform that I mentioned to you as a dream, is actually reality. And it is actually what I use. So it's here, it's now, and it makes life lots easier for me, my staff, my patients, and I want to share a little bit of it with you. So if you are seeing patients, whether they be you're in the office full-time, or whether you've got a skeleton crew that is allowed to see emergencies only, it's more important than ever to stay engaged with your patients. My practice, we have templated text messages that we text the patient to stay engaged, ask how they're doing, do virtual checkups with them. They can take pictures of things, send it to us, and we haven't missed a beat with any of our patients. Our patients are incredibly grateful that we are able to stay engaged with them. I actually had a patient today text my practice. She saw that it was my birthday and wished me happy birthday. I mean, you don't get that kind of engagement with patients that often. And again, because it's a text, it was very easy for them to do. If you are seeing emergencies only, then you're able to triage whatever the problems are, again, through the means I just described, and bring in only those that are of true emergency caliber. And the great news about that is you actually know what the procedure is you would be doing probably, and you can be prepared from a supply standpoint, everything else about what type of visit this person's coming in for. And it's really, really, really important that you pre-screen every single patient that decides that they're wanting to be seen. So in my text to patients, before I will even see them, We text them those 3 important questions. We even tell them, if you're coughing at all or have run a fever in the last 72 hours, we would rather not see you. And if we feel that can be done, that's what we want to do. But we also send out pre-visit instructions through HIPAA-ready text messaging. And these instructions basically say, stay in your car. When you get to our parking lot, text us, you are here. We will text you back when we're ready for you. And when we text them back, we will actually send out one of our nurses or assistants to go out and escort them in. They will hold, my nurse or assistant will hold the door open so nobody touches anything, and we'll go straight back to the exam room that is completely sterile. They'll sit on the table and we'll do whatever we need to do. And then when they're finished, they go straight back out and they are texted when their next appointment would be. So again, you can minimize exposure and practice exposure to anything by being able to do that. We encourage, in my practice, patient-initiated care conversations. We say, if anything's bothering you, if anything's hurting, if anything's swollen, please text us. If possible, take a picture of it, send it to us so that we have as much information as possible for you. And then, because we want to answer as many questions as possible and allay as many anxieties as possible before the patients arrive, so that the visit can be as meaningful as possible in the time that you spend with them. And by the way, I would tell you that having a communications platform this robust is going to put the care back in healthcare, because your patients, as mentioned, or I mean, not your, well, your patients are going to be incredibly happy with the ability to access you through text, social media, messaging, and or video chats. They're going to love all of the above, but your staff is going to love it just as much, because every one of them will be given back 1 to 2 hours of time every day. And that gives them more time to actually get to know the patients, rather than being bogged down with lots of administrative things that they do on a daily basis. And whether it's the doctors or the nurses or the staff up front, we're all bogged down with lots of administrative work. And basically, I skipped a slide. So what do you do now if your practice is closed? What am I doing now that I can only really come in when I have an emergency? Well, again, I'm staying engaged with existing patients. I'm also got ads out there on Facebook and everywhere else that basically says, hey, I am open for a virtual visit. While you're sitting at home with nothing to do, take selfies of whatever it is you're wanting to know, and we'll do our darndest to try to help you and hopefully be able to schedule them some type of new patient visit when we reopen. So again, being able to do these things actually can generate you and create for you income while we are quote unquote closed. And there are some new codes that have come out that do allow certain things virtually, like this. When patients want to know something, and you're giving them clinical advice of whatever, even if it is, hey, I'm running a fever, and you would tell them, please take Tylenol, but please do not take Advil. That's giving expertise, clinical advice, and those can be counted as exams and filed under insurance. Each state is different, but they do count those visits as a visit. And I know Iowa, and Jean may correct me later, so if I'm misquoting, I'm trying to paraphrase what I believe I heard her tell me yesterday, and that is Iowa wants to reimburse the docs the same amount of money as if you gave those same recommendations as an in-office visit if it were a non-in-office visit. So I'll have Jean talk to that at the end of this, but I believe that's what she said. There's also other folks out there. There's a lot of folks out there that are living alone, and they need to check in with somebody because they're social distanced out, so to speak, and they want to engage with a trusted person and service, and that trusted person may be you, and you may be helping them emotionally keep it together, and you may be delivering that type of service to these folks. And again, in certain states, those types of services are reimbursed. So just to let you know some things that can be done if you're quote unquote closed, yet you can generate some sort of income during this time. As mentioned, internal communications with your team. I mean, my team and I, they're all in their house. I'm in my house. We're logged into this communication platform. We can talk with each other about patients. We all see patients that are texting in about this, that, and the other, and we're able to stay on top of everything and understand everything that's going on within the practice. And the other thing that enables us to do is, because we're staying in such close contact with our patients, we have actually organized way out, I'm talking 3 months out, a schedule that not everybody is going to need to see us on the day that we're open. And in Tennessee, it was the 13th of April, but I think they've now changed it to the end of April, and it wouldn't surprise me if they change it even further. So that's why we're looking on down the road, and we are triaging, understanding who we can put that far out, and also understanding the patient base that we might need to see prior to that. So we can spread out all of our appointments in a nice way so that when we reopen, we're not going to be bombarded with every single patient I have, because there would be no way to see them all. At any rate, again, I talk about triaging with simple text. By doing this, you can basically prevent the spread of communicable diseases. For instance, if somebody has strep throat and you looked and they sent in a picture and they were being treated for strep throat and you noticed it really hasn't healed, you don't have to have that person in and spread diseases, amongst your staff and office. You could simply say, hey, I'm going to prescribe you another round of antibiotics because it doesn't look like you are healed quite yet. You can deliver home care instructions through text. You can basically attach an attachment with all the home care you want. And that can be, again, I don't know who all is listening here, but it can be physical therapy instructions. It could be anything and everything, muscle relaxation instructions, medication instructions, whatever. And like I said, it's very efficient to triage and schedule based upon disposition, how severe the case really is. Oh, I didn't realize. Here it is. That is how that came up. This is showing you a real live example. It says, hi, this is Jane. Sally has a sore throat and it looks like strep again. Does she need another round of antibiotics? This is Tracy from Dr. Green's office. We'll get the picture over to the doctor to take a look. Does she have a fever? If so, how long has it lasted? Yes, her fever is 101. It's lasted over 24 hours, and we've been giving her children's Tylenol. Okay, thank you. Sending this over to the doctor right now. She'll follow up shortly. Thanks. But this is the type of stuff that can occur when you look at, this would be asynchronous telehealth right here, where it's store and forward and messages are being moved around to the doctor if that's what they needed, or to a clinical staff. It could be a nurse who is licensed to be able to make the diagnosis or prescribe the antibiotics or whatever it might be. So let's look at some practices that were successful pre-COVID that were using telehealth and remote patient monitoring strategies. And the first is a pediatric practice in Texas, El Paso. This young doctor went to an area that was highly competitive and a well-established market. But she understood that in El Paso, they had the longest wait times in the country, just under 27 minutes. And she wanted to ensure her patients never waited that long. And she also wanted to offer a modern way to parents to communicate on the go. So here's basically what happened with her. She's gotten very busy, and her competitive differentiation is her ability to give the patients what they want, when they want it, and from the medium they want it. So what am I talking about? She's able to allow them to access her practice through text, social media messaging, from her website. She's made it so easy that it's not funny, and patients absolutely love that experience and actually feel that they are being treated like concierge because they have that kind of access. She is open on weekdays and she does virtual visits or on Saturdays. You have access to her practice 24/7, either her or her team. And here's something that's wild. 9 out of 10 patients connect with her via her Facebook business page through Messenger. Anyway, the other cool thing is she creates and is able to create smooth care transitions when needed, such as a child being hospitalized. Dr. House stays connected with the patient throughout their entire journey. So pretty cool. Another success story is Dr. Matheson here is an OBGYN practice, has 5 providers, 6 locations in Chesapeake, Virginia. And the biggest challenge she initially had was her staff their time was very inefficient doing things. Patients were unsatisfied with the wait times in receiving test results. So a pap smear was taken and literally patients could not get the result. They would be put on hold, had to leave a message, nurse was going to call back, never called back, and the frustration on the patient side was horrible, and they were leaving poor reviews. So the doctor wanted to spend more time with their patients and get better reviews. And after implementing a more modern communication platform, Dr. Matheson's nurses gained 2 hours of time back a day, and they were able to do 10 to 20 daily tasks less because of it. It reduced unnecessary visits, meaning unnecessary moms weren't having to come in. Again, they could text her and she could actually triage that and determine, no, you don't need to come in. It's not as an emergency as you might think. And again, alleviate concerns from the patient's home rather than clogging up her waiting room and again, becoming more inefficient. Once she implemented this type of platform, as soon as pap smears come back, they're attached and texted directly to the patient. The patient receives these results, and if she has to write something on them, or whoever, meaning the licensed personnel who writes, they write on the results. And if there's any questions by the patient texts the questions back and they're answered that way. She also found that her patients were way more satisfied, and she got increased positive Google reviews. And she would tell you it was a game changer for her practice, being able to offer these types of services and access. Last but not least, I'll tell you about a Sweetgrass Pediatrics. It's 6 locations in Greater Charleston. They have 22 pediatricians, 7 nurse practitioners. It is the largest Medicaid provider in the state, and they treat newborns to 18 years old. They had inefficient staff time as well. They have all these staff and they're not efficient because, again, they're having to deal with phone, they're having to deal with answering machine, they're having to try to call back. And by the way, when you call back somebody, you're usually using a back number, and so it's not recognized by the phone and nobody answers because they think it might be a robocall. So you spend countless hours chasing patients by voice call, by whomever it might be in your practice. You want to not do that. When they get a text, they get it from the number that's in their phone. They know who it is and they respond. And even if they didn't know who it was, they would read it, because 98% of texts are read within the first 30 minutes that they are received. Where if you try to email them something, emails are only, the open rate's 20% or less. So emails aren't going to be as efficient. Text is your most efficient form of communication, and that's what they respond to. And by the way, and I know I'm jumping a little bit ahead in the results, they were able to increase engagement of the Medicaid population 3 to 4 times, meaning they were able to get them through text very quickly and easily. They would text back, where 3 to 4 times greater than if they were voice calling. They were able to engage, and they tripled and quadrupled their engagement with these folks. Also wanted to let you know, she also wanted to spend more time with her patients to get better feedback and reviews. So what happened, she began to do, or not she, this is 6, I'm back on the other one. They began to do virtual consults allowing sick babies to stay out of the waiting room so they don't get everybody else sick. They reduced response time to parents' questions. They were able to, they have a textable triage line that allows patients to have one point of contact. Here is the number, and then that message can be triaged and routed to the right teams of people to answer at the right time. And it doesn't always have to be about clinical stuff. Clinical stuff is telehealth. Billing is administrative. Changing appointments, administrative. Refill prescription, well, maybe clinical type, but those are the things people are going to message in and text in about, all of that. So they were able to streamline their workflow for scheduling and patient inquiries with templated messages for common care instructions. And I can't stress the importance of that. Nobody is typing anything. I am the worst typer in the world. I pick a template, it fills it all out, and I send it. That's how easy it is. That's how easy you want it for your staff. You want your staff to be quality assurance as well, because I would worry with some of my staff what they may say on their own. So I would rather create templates for responses and personalized templates for responses that seem caring and from our voice and not from the voice of my employees per se. So again, saves lots of time. There is no typing on the computer or on a cell phone if you use an app or whatnot. So what do we want to look for when you choose a telehealth communication platform? What should you be looking for? Well, you should be looking for that the platform allows for more than just telehealth, meaning it's not just video, it's not just asynchronous. It's going to do more for your office than just that. It's going to create a more productive overall office environment and happy staff, happy docs. The burnout for docs is much less. The burnout for staff is much less. It's going to engage patients in the manner that they want to be engaged, which means they will do it. And it's been proven time and time again that engagement with an app or an engagement with a portal is low. The adoption of that is low. And when you create zero barriers to adoption, meaning the patients are doing what they do with their friends and family, there's nothing to download, there's no username, password to remember, there's no logging into portals, then the adoption is sky high because it's the way they want to communicate anyway. So here are the key takeaways today. The care delivery paradigm has shifted, and it's shifted permanently. This COVID epidemic has really changed the way we all need to begin thinking about healthcare and how it's delivered. And I truly believe what we'll find as time progresses is that more and more people will begin to understand the power of telehealth services, treating as many people for less acute things at home and leaving in-office time for the more severe things, and having a platform that allows them to accurately triage what's what and move messages to the right people at the right time, those messages that are urgent can get to wherever they need to be and a quick response can be had. Those less urgent, they can wait a little bit and they don't have a problem because waiting is the norm with texting. And virtual patient engagement has got to be a part of the new practice workflow. It just has to be. And you want to leverage a platform to streamline your practice's unique workflows so that the communication platform, the telehealth platform, is built to you, not the reverse, not slapping something down and say, okay, build workflows to it. No, that isn't what you want. You want a platform that actually can be tailored to your current workflows. At any rate, I believe this is the end of today's presentation. I want to thank all of you for being here.